Covering Unit Number 3, Chapter Number 22. Measuring Vital Signs. Items will be covered from 11 to 14 out of 50 MCQs. 1. What are 5 vital signs? Temp, pulse, respiration, BP, O2 and pain. 2. What do you understand by pyrexia? Fever. 3. What are pyrogens? Agents that cause fever. 4. What do you understand by febrile? Fever. 5. Normal body temperatures ranges. 97.5 to 99.5. 6. What is normal body temperature in elderly people? 96.5 to 97.5. 7. What do you understand by basal metabolic rate, BMR? BMR is the rate at which heat is produced when the body is at rest. 8. What do you understand by hypothalamus? Acts as a thermostat and controls body temperature by a feedback mechanism. 9. What do you understand by diaphoresis? Excessive sweat production, to cool the body by evaporation. 10. The term hypoxia means state of insufficient oxygen. 11. What do you understand by the term cerebral hypoxia? Insufficient oxygen to the brain. 12. What do you understand by pulse? Each time the heart contracts to force blood into an already full aorta, the arterial walls in the vascular system must expand to accept the increase in pressure. 13. What are some pulse points to take temperature? Temporal, forehead. Carotid, neck. Apical, heart or apex. Radial, thumb side of wrist. Femoral, between leg and abdomen, inguinal crease. Popliteal, behind the knee. Posterior tibial, inner side of the ankle. Dorsalis pedis, dorsal or top surface of foot. 14. What are normal pulse rate? 60 to 100 beat per minute, BPM. 15. What do you understand by the term bradycardia? Refers to a pulse that is less than 60 BPM. 16. What do you understand by the term tachycardia? Refers to a pulse that is greater than 100 BPM. 17. What do you understand by the term arrhythmia? Irregular pulse. 18. What is pulse deficit? Difference between the apical and radial pulse. 19. What are common terms to describe the strength of a pulse? 1 plus or weak and regular pulse. 2 plus or strong and regular pulse. 3 plus full and bounding pulse. Feeble, barely palpable. Irregular. Thready. Absent, no pulse. 20. Is respiration voluntary or involuntary? Involuntary. 21. What is an involuntary respiration? Decreased O2 levels, and increased CO2 levels. 22. Describe some organs involved in respiration. Nose, pharynx, larynx, trachea, bronchi, lungs. 23. What is normal range of respiration? 12 to 20 in a normal/healthy person. 16 to 20 in elderly people. 24. How do you count/record respiration? 30 seconds multiply by 2, or 1 full minute. 25. What is cyanosis? Bluish discoloration or skin color changes. 26. Explain eupnea. A normal, relaxed breathing pattern. 27. Explain dyspnea. Difficult and labored breathing. 28. What is tachypnea? Increased or rapid breathing pattern. 29. What is bradypnea? Slow and shallow breathing pattern. 30. Explain the term hypoxemia. Decreased levels of oxygen in the blood. 31. Explain the term hyperventilation. A pattern of breathing in which there is an increase in the rate and depth of breaths and carbon dioxide is expelled. 32. Explain the term Kussmaul respiration. An increased rate and depth with panting and long, grunting exhalation. 33. Explain the term Biot respiration. Biot respiration are 4 to 5 breaths of equal depth alternating with irregular periods of apnea. 34. Explain the term Cheney-Stokes respirations. A pattern of dyspnea followed by a short period of apnea. 35. What is an oximeter? A machine that measures oxygen in the blood. 36. What is a pulse oximetry? Method of monitoring the function of the respiratory system. It measures O2 saturation, %. 37. What is a normal range of oxygen in the blood? 92 to 100%. 38. What is an auscultation? Hearing of the sound made in the artery by the beats of the heart. 39. Describe classification of blood pressure. Classification: systolic, diastolic. Normal blood pressure: less than 120, less than 80. Elevated blood pressure: 120-129, less than 80. Stage 1 hypertension: 130-139, or 80-89. Stage 2 hypertension: 140 or higher, or 90 or higher. Hypertensive crisis: higher than 180, and / or higher than 120. 40. What do you understand by the pulse pressure? Difference between systolic and diastolic pressure. 41. What factors may influence blood pressure? Age, stress, and emotions, medication, diurnal variation, sex, exercise, body position, right vs left arm, vasodilation, vasoconstriction, head injury, reduced blood volume, increased blood volume. 41. What is Korokov sound? While measuring blood pressure, you may hear certain sounds that relate to the effect of the blood pressure cuff on the arterial wall is called Korokov sound. 42. What are normal blood pressure range in adults? 120/80 mm Hg. 43. What can cause by hypertension? Hypertension can cause permanent damage to organs. 44. What is orthostatic hypotension? Drop in blood pressure from 15 to 20 when arising to a standing position. 45. What are the symptoms of orthostatic hypotension? Faintness, blurred vision, and / or dizziness. 46. The nursing assistant reports to the nurse that the temperature of a patient who is first day postoperative is 100.2 F. Which action should the nurse take first? Notify the surgeon of heat temperature elevation. Check the preoperative temperature reading. Tell the nursing assistant to take the temperature again in 2 hours. Prepare to administer an ordered PRN, as needed, acetaminophen suppository. 47. Temperature greater than 105.8 F, 41 C, should be treated promptly to reduce the fever to prevent which health risk? Chemical reactions to oxygen in the bloodstream. Potential damage to the cells of the central nervous system. Heavy perspiration causing dehydration. The increased workload of the heart. 48. Pulse oximetry readings should be correlated with which other assessment or findings? The respiratory assessment. The vital signs. The hemoglobin level of the blood. Changes in blood pressure. 49. Which health condition or intervention may put a patient at risk of developing orthostatic hypotension? Select all that apply. The patient has received 3 L of 4 fluid within 24 hours. The patient had diarrhea and vomiting for the past 3 days. The patient is taking daily medication for hypertension. The patient has been somewhat nauseous for 48 hours. The patient has a sinus infection and fever with a temperature of 101.4 F. 50. Which are the signs and symptoms of shock that may be seen with hypotension? Select all that apply. Tachypnea, apprehension, tachycardia, cool, clammy skin, increased blood pressure. 51. When assigning vital sign measurement to the nursing assistant, the nurse says to take the apical pulse for the full 60 seconds. For which patient would this instruction be most important? A. A patient who is bradycardic. B. A patient whose usual heart rate is 76 bpm. C. A patient who is tachycardic. D. A patient whose heart rate is irregular. 52. A patient is receiving an opiate-based medication to help manage pain. Which assessment has the highest priority when monitoring the patient's condition? A. Temperature. B. Pulse. C. Respirations. D. Blood pressure. 53. You are caring for Ms. Hammersmith, an older adult woman who had abdominal surgery yesterday. The patient is to be discharged to a rehabilitation facility this afternoon. After she finishes eating breakfast, you assist Mrs. Hammersmith to a sitting position on the bed in preparation for getting dressed for transfer. As you assist Mrs. Hammersmith to the sitting position, she says, "Whoa, I feel dizzy," and you decide to measure orthostatic vital signs before proceeding further. From the following list of observations and measurements, highlight or place a check mark next to safety findings that require immediate follow-up. A. Patient is alert. B. Patient is able to state the facility to which she will be transferred. C. Patient states she sees stars. D. Pulse while supine, 74, pulse while standing, 96. E. Blood pressure while supine, 110/70, blood pressure while standing, 88/56. F. Patient is fully oriented. G. Patient complains of dizziness while standing.